Well, throughout this pandemic, we have been trying to make sure that you are getting the answers to your questions about COVID-19. So with that, let's bring in our medical panel. Dr. Amish Adalja, he is a senior scholar at the Johns Hopkins University Center for Health and Security and an infectious disease expert. And we also have joining us Dr. Jeremy Faust, a Harvard Medical School instructor and emergency room physician at Brigham and Women's Hospital. Doctors, thank you so much. This has become one of our favorite segments that Leland and I get to do. So I'd like to start with you, Dr. Faust. Our first question is from Sherry Messina. She writes, I'm 65 years old and high risk as I am a transplant patient and on immunosuppressant medications and have had symptoms like upper respiratory infections and have been unable to get tested. I've been on a list for 3 weeks, but they keep running out of test kits. How important is it to be tested as I have been self-quarantined for almost 3 weeks? Dr. Faust?
Thank you very much. This is a very interesting question, and I'm glad to take a stab at it here because people who are immune compromised are a little bit different. So I don't want to be too specific on this, but what I can say generally is that, first of all, we'd love to have more testing so that all these questions could be answered. That is a priority we need to work on. But to answer the viewer's question, the CDC gives us a little bit of guidance here. If you knew that you were exposed to somebody or you were in a high-risk area where there's lots of virus, they would want you self-isolating for at least 14 days. But if you can't get tested and you're trying to find out if you're contagious or what your risks are, they say a little bit differently. They say, just kind of watch your symptoms. You need to be fever-free for 72 hours, 3 days, without using anything that would lower your fever. So that's an important distinction. You need to be looking for symptoms improving overall for a couple of days at least. And in addition, there's some other things they want you to watch for. You can go to cdc.gov, but the big thing is here is that we don't know if you're positive today, you could be negative tomorrow. So it's kind of hard. You have to sort of reassess as we go. And that's what's difficult here, is that this is an ongoing issue.
All right, Dr. Adalja, next question goes to you. This is from Michael Josephson, and it's a pretty unusual question, but I think it's one that some people have certainly crossed some people's minds. Can you sterilize a cloth mask in a microwave?
There's no good evidence that you can sterilize a cloth mask. People have tried that. They did it with N95 masks in the past. It's unclear whether that works or whether when you do that, it makes the mask more permeable to particles. So I wouldn't necessarily do that and expect it to be reliable. And in general, cloth masks aren't the same thing as hospital-grade masks, so they're not going to give you that full protection anyway. So don't get a false sense of reassurance. Even though we've got this mask recommendation out there, this is not something that is a panacea, and it needs to not be viewed that way by the general public.
All right, we've got time for one more question. Dr. Faust, this one goes to you. It's from Diane Vine, and she writes, while abiding by the social distancing recommendations, what happens if someone coughs or sneezes on an aisle in a store? Is it safe to walk down that same aisle? How long does it take for virus droplets to dissipate and fall to the ground? I think that's a great question. My husband the other day was wondering if he goes on a run and runs past somebody that coughs, could you catch it? Dr. Faust?
It's on everyone's mind. And first of all, if someone sneezes on a shelf or a box, you have to assume that just like any other surface, the virus could persist there for quite some time. We know that plastic, for example, and stainless steel, things like that, the virus will be stable for the half-life, which is how long it takes for half of the virus to go away, is 5-6 hours, but it could last for days. So that's why when you're touching things at the store, you want to make sure that you really, really hand sanitize. In terms of the question of going by someone and is it in the air, the virus is not strictly airborne. In other words, it doesn't just float around indefinitely, but it does, as the question I think alludes to, it sort of hitches a ride on droplets if you sneeze or cough, and it can stay in the air for a little while. And that's why healthcare workers have to be so protected, because we're right up in their faces when we provide care. So that's why we're being very careful. Out for a run, I think that would be kind of a freak accident to see that, but of course you want to keep 6 feet away from anyone you can. And the same thing would be true in an aisle in a store. You want to keep your distance, and I don't think there's as much of a risk of that in an environment such as that, but the main thing is that we're not too crowded. So that's why stores are keeping the limited number of people per store at a time. So you're not likely to be standing next to somebody when they do sneeze and cough in your direction. Because if they were up in your face, yes, you could get it that way. But the question is, a minute later, are you going to be okay? That's a question.